So the issues managing intracranial aneurysms is mainly the evaluation and the balancing of many factors. This is currently done by multidisciplinary teams that do discuss the evaluation of the patient with all the different factors that are relevant to the disease management and balance that according to guidelines, according to the knowledge, according to many parameters, local parameters. There's currently no real tool allowing this assessment. We have different scores, but none of those scores are validated. And those scores do not actually take into account interdependencies between factors. And that's where we believe that digital twin in-house will take into account interdependencies and will allow to provide tools to the clinician to actually explore the interactions and explore the consequences of actions and better predict the outcome of patients. The other thing which is extremely limiting is that we acquire a lot of data around the globe, and we have all different ways to quantify those quantities. And we're going to work on building a knowledge base and a knowledge graph that will allow integrate data from around the globe to actually increase the robustness of our knowledge base. And finally, clinicians are assessing patients. And when I say assessing, is that they're looking at imaging and they are more or less looking at how it looks. There's no real quantification, there's no real measurement, and the measurements are very rough. And we believe that using the digital twin in-house will allow better quantification from the raw data that will be proposed to the clinician that will validate them. So the issues managing subarachnoid hemorrhages are very similar to the issues we have managing unruptured aneurysm. The subarachnoid hemorrhage is actually the consequence of the rupture of an aneurysm. And the bleeding is injuring the brain. The blood around the vessels is actually initiating some reactions, which are vasospasms or hydrocephalus, which are other issues additional to the initial lesion. We strongly believe that the digital twin in-house will allow integrating information from the intensive care and actually get that monitoring data integrated in the models, allowing a better understanding of stroke and allowing a better understanding of how we take decisions on a daily basis or even on an hourly basis, which will most probably improve the outcome of those patients.